to. Oh, it's already recording. Okay, perfect. All right, well, we are happy to be with you today. Thank you for watching this video. We are BYU students working with Community Health Connect. My name is Jackson Tadji.
I'm
I'm
Andrew
Lindsay.
Wood,
Well, it's a pleasure to be with you today. We're going to go through this presentation on oral health. We want to help you all have happy teeth, right? But like I said, we're here with Community Health Connect here for this class, and we will take you through these slides. Any questions, we'll have some contact information at the end of people that you can reach out to.
Okay, so today's class objectives are to understand oral diseases in general, and how we can prevent them, and then the good habits that we should be in, just daily habits for keeping our teeth clean, and then understanding the Community Health Connect policies and further steps to get your dental care.
Awesome. So first, let's start off with some basic understanding of dental plaque and tartar. So plaque is bacteria, food particles, saliva that builds up as we eat, and it sticks to our teeth. And then plaque will turn into tartar if we don't brush it away. So tartar is just plaque that is not brushed away and hardens over time. And that's just a little bit tougher to get rid of. So it's always easier to get rid of plaque before it turns into tartar. Usually when it gets to tartar, dentists have to go in and help and scrape that away for you.
And so this is the stuff that can happen if we don't get rid of that plaque and tartar. So first off, gingivitis right here. So that plaque and tartar will start to irritate the gums. The gums will start to appear red and puffy. They'll look inflamed. There can be some bleeding as well. And we can see the difference here between these healthy gums and the healthy bone levels. And then down here where we have this gingivitis, or even when it progresses onto periodontal disease, which is gingivitis that goes untreated. So here we can see the gums right here in the red. This is retreated. We get some of this bone loss down here. So instead of this healthy gums and bones that are right up to the tops of the teeth, we have these gaps right here. So that's where we can get that bleeding and that red, puffy, inflamed appearance. And then that gingivitis can progress on to periodontal disease if it's not treated. So that's why, like Andrew was saying, that's why it's so important to get on top of this early and make sure that we're getting rid of that plaque before it turns into tartar. And then it's always easier to prevent than to treat.
And then tooth decay can happen if we have those like gingivitis and periodontal disease. And that will be due to the enamel that gets damaged. And the enamel is what covers the tooth, and that's that protective layer. And you often won't notice that it is damaged until you do feel the pain. And if you can see in like the picture in the lower left, where the enamel is damaged and then it just has straight access to your inner tooth. And that's super painful. That can cause abscesses, and that's an infection. And then that's when you would have to go to like the ER or an urgent care to get antibiotics to treat it.
Yeah, and we can see this little hole right here. So that hole starts off as a slight cavity, which is just when that plaque and the tartar start eating away at the enamel. But then as that gets farther on, like Lindsay was saying, that can get into the nerve. And that's when it gets very, very painful.
Okay, quick question talking about preventative care. True or false? Slight decay can reverse with diligent brushing and flossing. We'll give you 3 seconds to think about it. Okay, the answer is true. It's always good to continuously brush, and you can prevent these things from getting worse.
Yeah, so like I was saying earlier, it's always easier to prevent than to treat. So if we can catch things early, some of that slight decay can actually reverse and we can prevent further problems. Like I was saying with that slight cavity that can form, like if we look back at this picture, if we get that slight cavity, but if we start brushing and flossing where we maybe weren't before, that can reverse and we can end up with healthy teeth again because our teeth are living and they grow. And so that can prevent those further problems and that worsening that would end up with a potential ER visit down the road.
Okay, so some daily habits that are good to get into are to brush your teeth twice a day and flossing at least once a day. And then choosing to eat healthy foods. And the next slide, we'll go over some healthy food options. Chewing sugar-free gum is better than just to make sure that you aren't getting as much sugar. And then regular dental checkups, usually about 2 a year. And then using mouthwash. And the mouthwash you could get with some fluoride, and that will help strengthen your tooth enamel.
Okay, another question for proper brushing. True or false? A toothbrush with hard bristles is better than a toothbrush with soft bristles. And that is false. Soft bristles are a little bit better and can clean better on the teeth. And then the ADA recommends replacing your toothbrush every 3 to 4 months. That way too much bacteria doesn't build up. So remember to replace your toothbrushes.
For those of you who aren't aware, don't know, the ADA is the American Dental Association. So they're in charge of all the research and dental, everything dental related in America. All right, so proper brushing technique. So believe it or not, there is a good way to brush and there is a bad way to brush. So like Lindsay was saying, you want to brush, make sure you're doing that 2 times a day. So usually at night, and the other time you can do it in the morning, or you can wait until after you've eaten when that plaque and tartar starts to build up. So 2 times a day using a circular up and down motion. Like it says here on the down here by the bottom, you want to avoid scrubbing side to side or scrubbing too hard, because that can actually wear down your gums and you can wear down the enamel as well. So you want to brush up and down circular motion. You want to brush teeth at a 45-degree angle. Like you can see here, the toothbrush is just slightly angled. You're gonna make sure you angle that just so we're not coming really, really hard on with those bristles. We want to brush our gums and our tongue because the plaque and tartar can build up there as well, and we can get that bacteria. We want to make sure we're gently brushing the gums and the tongue so we're not wearing those down. And one really important thing as well, you want to help make sure if you've got children that you help them learn how to brush. So you really want to be self-sufficient, make sure that we're learning good habits early, because a lot of these habits are tough to break. If a lot of bad habits are tough to break. So we want to make sure we're developing these good habits early on. And if we don't have them now, then we're developing them now and doing that from here on out to make sure we're keeping our teeth healthy.
Okay, so proper flossing technique. So if you have like the floss that you get out of the little container, then the little string, you'll wrap it around your 2 fingers, and as like the person has, and in between their teeth, then you'll move it like side to side and back and forth, and then take it out. And if it has any food particles on it, just make sure to wash it off, and then you can go to the next tooth and continue that process between each tooth. So yeah.
Alrighty, dental checkups. We kind of talked about this earlier, but it's recommended you go twice a year to see your dentist. And so what happens at these dental checkups is you'll get x-rays once a year or twice a year for an exam. That way they could just see the beginnings of cavities, so that way you can prevent them in better forms. And then cavities can also be detected before an infection begins to spread through the entire tooth. This is much easier and cheaper to fix. Again, prevention is key. And then dental cleanings get rid of plaque and tartar, and they put fluoride on your teeth to help fortify your tooth enamel. So they'll go ahead, clean your teeth. That way the dentist can inspect them, and they'll also put that fluoride in your mouth that's going to help strengthen them to prevent further damage.
And like Lindsay was saying earlier, it's really recommended that you get mouthwash with fluoride. You can get toothpaste with fluoride. Fluoride's going to act like, like it's saying here, it strengthens the enamel. So the enamel right here is going to act like a shield or armor on the outside of your tooth. So it helps prevent that bacteria and the plaque and the tartar from getting inside. You can see it's kind of worn away. We have this hole right here, which would be a pretty serious cavity. So as we use that fluoride, the dentist can do that. They can put that on our teeth, or we can get that in the mouthwash, like we were saying. It's going to help strengthen the outside to make sure those cavities are prevented. And a lot of this has to do with healthy eating as well. So it's recommended you get these vitamins, minerals, dairy products, plenty of water. All these things will also help to strengthen and maintain our enamel. What goes into our body is going to play a pretty significant role in what becomes our body, right? So what we're eating is going to affect our teeth composition and then the strength of those teeth.
So choosing nutritious foods such as like plain yogurt, it has less sugar than flavored yogurts and that. Low-fat dairy products, raw vegetables and fruits, those have a lot of vitamins and nutrients that we need that help strengthen our teeth and also other health benefits. And then high protein foods like eggs, fish, and meat. And so those are important things to get in your diet regularly. And then to avoid sugary foods, highly processed foods, sugary drinks such as like sodas and juices. Smoking and tobacco are also pretty harmful to your teeth. We'll go over those in a couple slides too about what effect they have on your teeth.
Alrighty. Couple of healthy habits to focus on here. Never go to bed without brushing your teeth. And then after you brush your teeth, don't drink anything but water. Again, water is just not going to add any bacteria on your mouth. And so you go eat food after brushing your teeth or drink different juices, then it'll add. That's just going to kind of reverse what you did with brushing your teeth. And then avoid coffee, soda, alcohol, tobacco, tea, and other substances that will stain your teeth.
Yeah, like we were saying, what goes into your body will end up becoming your body. But a lot of these substances, like here, everything down here that can stain your teeth and turn them darker, and it can harm that enamel. So really important to avoid those. And if you do partake, to do it in moderation. Like we were saying, smoking, you want to avoid smoking. Other than just staining your teeth, it's really harmful to your gums and your enamel. It can cause oral cancers, and other drugs can lead to rapid tooth decay. So, again, smoking, drugs, these different things that are harmful to our bodies, they're going to be harmful to our mouths as well. It can really cause our oral health to decline very quickly.
And then a few more points. So children and babies, if you want to give them a bottle when they go to bed and they have already brushed their teeth, just make sure that there's water in the bottle instead of like juice or milk, because that will also harm their teeth instead. And then finding toothpaste and mouthwash with fluoride. Like we said earlier, the fluoride is what helps protect the enamel, which helps protect the inner tooth too, and protect the nerves. And it is especially important for children and then they also apply fluoride at dentist appointments. It's kind of feels fuzzy on your teeth after they put it on. And that will just help strengthen your teeth. So I can also do this one. So if you have diabetes, it is especially important to take care of your teeth. Just because diabetes puts you at a greater risk for gum disease, infections, and dry mouth. And then eating healthy when you have diabetes has multiple benefits. So you'll just feel better in general, and your teeth will also be healthier. So.
Alrighty. Well, here we can look at some numbers, and this will tell a really interesting story. So this is the national average cost of dental procedures. If you look on the left side, they're the preventative cost, and you look at the right side, they're the cost of restoring. And so the oral exams, roughly, these are national averages, so roughly $66, x-rays $110, sealant $44, toothbrush a whopping $2, toothpaste $2, floss $1. So it's obviously a lot cheaper to prevent. Then you go on the other side, different types of fillings, 110, 131, root canals over 700, a crown 600, extraction over 100, wisdom teeth replacement or removing wisdom teeth over 200 to 300, dentures, implants start getting into the thousands. So obviously the thing that we'll continue to reiterate is prevent, and that's always the best case scenario. That way you don't have to pay more, and it's a lot cheaper to prevent rather than have to restore.
So if we're saying it over and over, it must be important, right? So like Andrew DeBrelli said, we'll say this again. The answer is prevention. Prevention is so much better to prevent all these diseases and different things. Is so much better than to have to treat them farther down the road. So it's cheaper. It's more healthy. It will cause much less pain for your mouth. So like I was saying in the slide before, tooth replacement's about $3,000. So if you look at an adult mouth, if you have your wisdom teeth out, you go from 32 teeth down to 28. So we got 28 teeth at $3,000 a piece. That's about $100,000. So if we look at our mouth as $100,000 investment, that's something that we want to take care of. right? So much better to prevent all these diseases and decay and all the bad things. Much better to just treat our mouth well, save the money, but also save the pain and save the all the other things that can go wrong.
Yes. Okay. So, Community Health Connect, they have a requirements for this class. So like, to get treatment, you have to attend this class, and then you'll call Community Health Connect, the center again, and then they will set you up with an appointment to either the Utah College of Dental Hygiene, Provo College, or the Mountainlands nonprofit dental clinic. And there you'll get your teeth cleaned. And I think that they try to make it a minimal cost, probably about like $10 to get your teeth cleaned at one of these places. And um, they'll also get you x-rays so they can check your teeth with x-rays too. So we have like the information here. It's nice because it's in Provo and Orem, super close. And they should be pretty accommodating with schedules. And so once you get your teeth cleaned, then you'll call Community Health Connect again, and then they will set up your appointment with a dentist to get your care taken care of. So yeah. And then these are also great sources to get your teeth cleaned. Since they do recommend like about every 6 months to get your teeth cleaned, it's an affordable option, and a great way to keep to prevent any further, like any worse diseases or anything that could happen to your teeth.
We recommend dental visits twice a year and dental visits with x-rays, because that's so important here. Like these two that do these dental visits with x-rays, these oral exams, a lot of those cavities, like we just talked about earlier, how slight cavities can be reversed with brushing and flossing. The only way to find cavities like that is at the dentist. That's something that we can't do on our own. So those x-rays are so important because the dentist can go in, they can see the state of our mouths, and they can really make good recommendations for how we can protect our health moving forward.
All right, so a couple program reminders of Community Health Connect. This is a one-time program. All dental services are donated, so we always need to be grateful because all the dentists are donating their time. And we only help with fillings, crowns, root canals, and tooth extractions. Only medically necessary dental work will be done. No things such as teeth whitening, braces, dentures, bridges, or implants are performed at Community Health Connect.
Okay, so like Lindsay was saying, first off, the first thing you need to do is attend this class, which either in person or this video, which if you're doing, fantastic job. That's step one done. So after you watch this video, you'll want to call Community Health Connect, and they will help you set an appointment for a dental hygiene cleaning. It's like we were talking those different clinics in the place that we put on the slide before. If you're not sure how to contact those, you can go back, get their contact information, or just reach out to Community Health Connect, and they will help you set that appointment. After that appointment is done, you want to call Community Health Connect back, and then it will be time for your appointment with the dentist. Just make sure after every one of these steps, you're calling Community Health Connect, and they will help you set the next one to make sure that we've got you moving along. Okay, any questions? Yeah. We appreciate y'all coming. Appreciate y'all watching. Here's Community Health Connect's number down there at the bottom. Again, after watching this video, give them a call, and they'll get you taken care of to make sure you're moving on to the next step. Okay. Thank you all so much.
Take care.